Here we go. Alright, so I've got a bag of fluids. Open the bag. And then, this is the IV line. They're laughing, I'm laughing. We open the bag. Oh, the how-to videos. Okay, open the bag. So the two ends, there's like the pokey end. It has like kind of like a big needle.
Okay.
And then this is the one that's gonna go into the actual little needle.
Oh, okay.
So we find the part that has the white tip.
Okay.
Okay. And what we're gonna do is, this bag has this blue little notch. And just take it out.
Okay.
Like this. You wanna hold the bag like upside down.
Okay.
Because otherwise the fluid can leak out. So I hold the bag upside down. And I'm gonna open this.
Okay.
And basically take this and put it in this bowl.
Okay.
And you want to go in really as far as you can.
Okay.
So that it has a pretty tight seal.
Okay.
This is what it looks like.
Oh, got it. Okay.
Yeah. Kind of has a little notch here, so once you get to the notch, it'd be really hard to keep pushing, and that's kind of where we stop. And then there are these two pieces in here, and they're basically clamps.
Okay.
So if I move this, it basically stops, you know, the line, because it clamps the line.
Oh, okay.
That's how we stop the fluid from just like free floating.
Got it.
And then so is this thing. It's got a wheel. If you turn the wheel and you'll feel the pressure, it's basically doing the same thing. It's like a double check system.
Okay.
To make sure that fluid isn't just going to flow out.
Okay.
When we do it the first time, we do need to let the fluid kind of run through, so we're not putting in a bunch of air.
Got it.
Underneath the skin. It's okay, it's not going to be super dangerous if we get a little bit of air, but ideally when you put together the bag for the first time, we'll run it through. So I'm actually going to open this all the way. And I know when it's open, when I can move this up and down.
Okay.
When it's clamped, it won't move. Like it's just stuck.
Okay.
Okay, so I know it's open when it'll just move. And I'm gonna open this. And I'm gonna invert it or hold it the right side. And then I should start to see fluid come out, see?
Oh.
Now that it's coming out, I know it's flowing well, and we call it priming the line. So I know this whole line now is filled with fluid and not gas. So I'm happy. I'm happy with this bag is now officially set up to use. So I'm gonna take this end and the needle. I'm gonna take out the needle and basically twist this off. I'm gonna put the needle on here like this, and you can, there's like this like kind of like a spiral, and it will secure it if we just twist it up.
Okay.
Okay, and then when we need to take it off, you do need to remove it and then basically just like pull it on and off.
Okay. Got it.
Once I put it on, I do screw it in just so it won't just pop off.
Okay.
This is what it should look like when it's all set up. Now we need our patient. So the best place to do it, like if you feel, he has usually like loose skin. And the idea, we call it subcutaneous injection. It goes underneath the skin. It's really safe. You're not going to hurt anything because there's no vital structures right underneath the skin. And the needle is not deep enough, like unless you're going sideways, you're gonna penetrate anything. So my biggest tip is that take the needle and always think about going parallel to the body.
Okay.
And not like this way.
Okay.
Okay? So the best way is to tent up the skin.
Okay.
And go kind of parallel to the body. So the direction of my needle is going this way, and not into the pet perpendicularly. So you just pull up the skin and go this way. It's helpful
This is so
Because like
hairy.
there's a lot of hair. If it's hard to see where the skin is, because it's not uncommon where we tend down the skin, we're going in and you're actually just inside the hair.
Right.
So sometimes it's helpful if you can wet the hair a little bit so we can
Okay.
see where the skin is, but this is the best place to do it.
Okay.
Okay, I'm actually gonna have you try because you're gonna have to do it at home,
Yeah.
so I want to make sure you can do it.
Okay.
So are you right-handed?
Yes.
So then you are
Would wanna
gonna.
hold it.
You can either from your direction, like you can go this way,
Okay.
or if you want to come around to where I am, then you can go this way.
Because I should insert it with my right hand.
You should insert it with your dominant hand.
Okay.
So you pull out the skin with your left and then going with your right. So from where you are, then you would tend then go this way.
Okay. I can do it that way.
Yes. Go.
Should I
And
take off the cap?
ideally,
Baby boy.
I'm gonna be your hanger.
Okay.
But at home, if you're doing this by yourself, then the fluids always need to be above the patient because
Okay.
gravity pulls it down. If I have it on the floor, it's not gonna flow to him.
Okay.
So at home, usually I tell people like you can get like a clothes hanger and
Yeah.
just hang it over like a door
Okay.
or somewhere a little higher. But I'm just gonna hold it for you.
Okay.
So yeah, before you inject, we just make sure everything is closed so nothing is flowing yet. Go ahead. Take it off.
Am I twisting?
You can do a little twist, but it should just be like straight. There you go. Perfect. Got this.
Just.
And just do a quicker thing is easier. You got this, like a pro. Alright, so if you got this hung up already, then we open this and the other. And you should see when it's flowing. You'll see the fluids dripping.
Got it. Okay.
Okay. He's a bigger dog, so we're doing 500 cc. There are these lines
Okay.
on the back. Goes from like, it starts out really picture that it's actually starting with 0. Each line is 100 cc.
Okay.
So he's going to get about half the bag each time.
Okay.
So each bag should last you, two administration.
Okay.
So 2 days worth. So each time, if we're doing 500, then today it's gonna go to 5, and then the next time they'll go to the rest.
Got it.
Okay. It's faster if I squeeze it. See how much faster?
Yeah.
Then he'll just have to not be here as long. So I usually do squeeze it a little.
Okay.
And usually the higher I can be, the faster it'll go. You're like the perfect patient for this. Thank you for being my demo dog.
He's like, I hate
It's like,
everything and
this
everything
is
sucks.
not okay, but I will just tolerate it.
Honestly.
I know, you've been so good.
Amazing sweet boy. Yeah, you're doing a good job.
You are doing a great job.
Does he have to be standing or can he sit?
No,
or lay
he
down?
can be however he wants to be. So
Okay.
if he's lying on the couch,
Right.
that's easy.
Okay.
Are now at 5. No, that is not like super exact, of course, because his bag is not designed to be like super exact. But with
Right.
subcutaneous fluids, it's not like we have to be exactly the right amount. So, you're happy? It's at 5-ish. Yep.
Close enough.
Close enough. Happy. So before we take it out, I am gonna close the port, just so that's not gonna hurt anything. But if I don't close it, I take it out, there's gonna be
Right.
water everywhere.
It's happened
We've
to me.
definitely done that a couple times.
Yes.
So we close this, close both. Now I can just set the bag wherever.
Okay.
And then usually before we take it out, I'm gonna just put a little bit of gentle pressure right next to it. And I just take it out. I'm gonna keep my finger on there for 30 seconds or
Okay.
so. It's not uncommon that you get a little bit of fluid coming out from that little hole where the needle was just in.
Okay.
That's okay. Not all the fluid's gonna just leak out.
Okay.
So you want to make sure you cap it back, your open needle is leaving. See, I'm not really seeing fluid leaking back out.
Okay.
I'm happy. And we usually will feel a little lump in this area, which will go down usually within a couple hours. By the
Okay.
end of the day, should pretty much be gone. Sometimes you'll see, just because it's a pocket of fluid, that gravity can pull it down in different ways. So it's
Right.
not uncommon sometimes, like in a couple hours, you notice like, oh, it's over here or it's over here. Doesn't hurt them.
Okay.
And that fluid will just, the point of the fluid is to get absorbed by the body.
Right.
So wherever it is, it'll get absorbed. So, and it'll go down.
Perfect.
Usually in a couple hours or by the end of the day. And that is it.
Thank
job.
you. Says I hate this.
You are not very excited about this, I know. Okay, bye.
And I'm sorry.
Thanks for helping. And also you want to get in the practice of just each time after using a needle, just change it to a clean needle. That way it's not contaminated needle on that fluid line. So I take a new needle and just put it back in. I screw it. I screw it on.